Hypertension, or high blood pressure, is a leading cause of premature death and disability, significantly increasing the risk of conditions such as stroke, heart attack, and kidney disease, the biggest killers of people worldwide. Despite the availability of proven and effective blood pressure lowering drugs and established treatment guidelines, control of high blood pressure remains poor.
Over 1 billion people globally have high blood pressure, and several hundred million are living with cardiovascular disease. These numbers are projected to rise significantly over the next decade. The scale of the problem is staggering. 9 million people die every year worldwide due to complications from high blood pressure, with more than 3/4 of these deaths occurring in low and middle-income countries.
Current treatment approaches rely on multiple factors to be successful. Safe and effective medicines have to be available and affordable. Doctors and patients have to diligently follow often multiple steps in treatment protocols. And medicines need to be taken reliably for long periods of time.
Because of the cost and complexity of current approaches and the lack of medicines that are both highly effective and affordable, only about 1/3 of people with high blood pressure globally receive treatment for it, and of those, the large majority fail to have their blood pressure controlled.
With these challenges in mind, researchers at the George Institute started to think differently about how to address the problem.
About a decade ago, we started researching hypertension polypills. These are single pills that each contain multiple medicines, each at lower than standard dose to treat high blood pressure. Our research found that access to such polypills resulted in many more people achieving their blood pressure targets much more quickly than the usual way of treating hypertension. For example, we ran a study of a 3-in-1 pill in Sri Lanka where over 2/3 of participants on polypills reached their blood pressure targets compared to just over 1/2 receiving normal care. We obtained similar results with a 4-in-1 polypill in Australia using even lower doses. In all of these trials without any increase in side effects. So polypills represent a simple yet powerful step to get people from no treatment or just one drug quickly and reliably up to all they need to be on and to stay on to adequately control blood pressure and, most importantly, to prevent cardiovascular disease. The priority now is accelerating the uptake of these polypills into clinical practice globally so that they can have the greatest impact on health outcomes.
By simplifying treatment and making medications more affordable for people at highest risk, researchers at the George Institute challenged conventional thinking about how cardiovascular risk factors should be treated, with the potential to save millions of lives.
Globally, we have only just scratched the surface in terms of getting proven treatments to those people who need them the most. We have to use every strategy possible to fast-track providing the necessary levels of care to those with little or no access. And polypills for a range of conditions are a simple, low-cost and effective part of the solution.